Hello, this is Mikael Nordfors with part 5 in the course in Tendon Attachment Therapy. This one is about the back and gluteal muscles and how you can heal problems in these areas. While watching this video, stop the video between each muscle and try to find the mentioned tendon attachments on yourself or the body of a friend. This will give you more of a hands-on experience. The first muscle is a very important one, erector spinae muscle. It has three parts, pars spinalis, pars spinalis is here, pars longissimus, and pars iliocostalis. The spinalis part, pars is part, you can say in Latin, has the origin on the tip of each spinous process, the one that goes straight out in the midline and goes up to the skull. The longissimus part is on all the transverse processes, the one who goes sidewards and connects to the ribs. And goes also up to the skull and the mastoid process. The iliocostal part, pars iliocostalis, starts down here in the medial upper surface of the pelvis and goes on the back of the ribs all the way also up to the skull. Once I had a disc hernia here in L5, and I didn't understand why when I got problems with my disc hernia I also had problems in the shoulder. And then I studied some anatomy and I saw this was because the pars iliocostalis was affected here and was tense all the way up here in the shoulder. When I discovered this, I could treat it and get well. Here is a vertebra. In the cervical vertebra, you see how the spinous process you can press on the side, laterally from the side, on each side here. This is the spinous process. Here's the transverse process, so you can press here directly inwards. And this is the skin here. Multifidus is a muscle that goes a little bit deeper down than the erector spinae, and it has the origin on the spinous processes too. And the insertion is on the sacrum, posterior superior iliac spine. That's this little thing here, and the iliac crest here, and the sacrum here. It has lots of proprioceptive nerve fibers, and it's important for the how the position is perceived from the brain. It helps bending the back backwards like all the other back muscles. Then we have the M.Quadratus Lumborum. It has the origin from the underside of the chest, and the insertion is on the top of the hip bone here. This is very important points for people with back age. You can also do the transverse processes here on the vertebrae. Latissimus Dorsi is a back muscle that is also an arm muscle. It has the origin on the spinous process of vertebra T7 to L5, on the iliac crest here, and on the inferior 3 or 4 ribs, and the inferior angle of the scapula, just here. You can see it here, maybe better. It rotates the trunk and moves the arm backwards and rotates the arm inwards. And the insertion is here on the humerus, on the intertubercular groove of the humerus here. Gluteus medius is on the iliac bone, just under the edge here, the crista iliaca, and the insertion is on the trochanter major. Trochanter major is just insertions all over the place. You can always massage the whole thing here, and it should be pain-free when you are ready. This muscle prevents the pelvis from dropping to the opposite side when standing on one leg and pulls the thigh away from the midline. Gluteus minimus has a similar action, but the origin is a bit lower down. It also helps the anterior fibers, helps rotate the thigh inwards so that the feet point more inwards. Gluteus Maximus is the biggest muscle in the body. It has the insertion from the sacrum here, on the outside of the sacrum, and from the medial tip of the iliac bone. And the insertion is just below the trochanter major and down in the iliotibial tract, going down all the way below the knee, on the lateral side of the knee. When the gluteus maximus takes its fixed point from the pelvis, it pulls the thigh backwards. You kick backwards, like a donkey. Taking its fixed point from the below, it acts upon the pelvis, supporting it when standing on one leg. Its most powerful action is to cause the body to regain the erect position after stooping by drawing the pelvis backward, for example when digging a ditch like this man here. So go up like this. This is the action of Gluteus Maximus. And then we have a small one called Quadratus femoris. It has the origin here on the lateral side of the ischiadic tuberosity, the sitting bone, and goes just on the lower part of the lateral side of the trochanter major here, in the intertrochanteric crest. Now it comes to maybe the most important muscle to treat in the body. I call it the Bandit muscle, or Musculus piriformis. It has the origin from the inside of the sacral border here and goes to the trochanter major like all other ones. It makes lateral rotation of the hip. You can say it helps dogs to pee, lift the leg backwards and rotate it backwards. And then the obturator internus has a similar action, and it comes from the inside of the sitting bone and goes also to the trochanter major here, together with the two gemellus muscles, superior and inferior. And these two muscles groups can pinch the sciatica nerve here, the ischiadic nerve, and that causes sciatica. And it can also make circulation problems in this leg, and it can also affect the motoric innervation to the gluteal muscles, so you become weak in these muscles, and that affects the whole posture, and you get back pain then easily. So this is very important to treat these muscles. You can very often, when you have the piriformis syndrome, you have symptoms from one side of the body, from the shoulder down to the feet. Here you see the piriformis from inside. You can also reach it rectally by putting one finger in the rectum here and push from the inside. And that can be more effective to treat it, but also maybe not so pleasurable for either the patient or the therapist. Here's the obturator internus also from the inside. Here we have the muscle attachments from the pelvic bone, from the inside of the pelvic bone. Here you see Quadratus Lumborum, sacrospinalis of the rector spine, and the obturator internus is a big one here. Here you have from the outside Latissimus Dorsi, the obliquus internus and externus. Gluteus Maximus is here, Gluteus medius here, Gluteus minimus here, and obturator internus down here. And here you see the gemelli. This is towards the midline, the pubic bone, and this is towards the hip bone here. The hip bone is here, of course, but I mean to the side. Here you see the attachment of the piriformis muscle on the inside of the sacral bone. On the outside you have mainly the multifidi and the gluteus maximus here. And here is the piriformis muscle and the obturator internus on the front of the hip bone, of the thigh bone, I mean. And gluteus minimus here. Here is the gluteus medius from the back of the thigh bone. And here is Quadratus femoris and the psoas and iliacus muscles.